Welcome back to the deep dive. You gave us a stack of sources this time that takes a drug class we thought we fully understood, these GLP-1 receptor agonists, and it just flips the script entirely.
It really does. I mean, we all know them for managing type 2 diabetes and, of course, for weight loss.
Right, that's the headline everywhere.
Exactly. But our mission today is to move way past that. We're going to look at their potential role in, well, counteracting aging across the entire body.
That is a huge leap. We're going from molecular changes in mice all the way to survival outcomes in actual human patients.
It's a massive conceptual jump from just a blood sugar drug to maybe a tool for molecular rejuvenation.
Okay, but before we get into the data, researchers have a pretty high bar for what they call anti-aging, right? It's not just a buzzword.
No, not at all. There were really 4 key criteria for an ideal anti-aging method. First, it has to be a pharmacological approach.
So a pill or an injection, something scalable.
Precisely. Second, it needs a really good safety profile. You can't fight aging with something that's, going to cause a ton of other problems.
Makes sense. Safety first. What are the other 2?
Third, it needs broad applicability. It has to work across multiple organ systems because aging is a systemic problem.
So not just targeting the skin or the heart, but everything.
Exactly. And fourth, it has to have synergy with other therapies. And the reason we're even talking about GLP-1s is that they seem to tick all 4 of these boxes.
Okay, let's unpack that. Let's start with the mice, with the functional aging data.
Right. So researchers took aging male mice, about 11 months old, and treated them with exenatide, which is a specific GLA-1RA.
And they did this for how long?
For 30 weeks. And they were looking for, actual functional improvement.
And did they find them?
They did. They saw these clear, significant improvements in 2 key tests. Forelimb grip strength.
So muscle power.
Muscle power, yeah. And also on the accelerated rotarod test, which measures motor coordination. And these improvements just got bigger and bigger over the 6 months.
And the context here is so important because the untreated mice, they were declining.
That's the key. The vehicle control mice showed a significant age-dependent drop in grip strength. So the drug wasn't just holding the line, it was actively counteracting that physical decline.
Okay, but here's where it gets really fascinating and maybe a little counterintuitive.
The selective nature of the benefit, yes. So they also measured things like spatial learning and memory with the Y maze and Barnes maze.
Cognitive stuff.
Exactly. And what they found was that those cognitive measures, they were stable. They hadn't really started to decline yet in the untreated aged mice.
So because those functions weren't broken yet?
The exenato treatment didn't significantly improve them. And this is really the aha moment for you. The drug isn't some indiscriminate booster.
It's a fixer.
It seems to be, yes. It selectively targets and repairs the pathways that are already vulnerable, the ones already showing failure. It fixes what's broken.
That really points toward a mechanism of, what, damage repair? Or reversing some kind of accumulated molecular mess?
It points very strongly in that direction, which we'll get to with a multi-omic data. But first, let's talk about the metabolic side.
Because you'd expect massive weight loss, but that's not what happened here.
Not really. The aged mice on the drug had, basically the same food intake and overall body weight as the control.
But they still saw metabolic changes.
Yes, and this is important. They saw a measurable reduction in gonadal fat as a percentage of body weight. So even without that big drop on the scale, the drug was actively remodeling specific fat depots.
So it's working on a much more subtle molecular level before you even see the big weight changes.
I think that's exactly right. But there was a twist, a behavioral one.
A psychological side effect, it looked like.
It did. In this open field test, the aged mice getting exenatide, they showed increased center avoidance.
Meaning they were hugging the walls of the arena.
Right, which in rodent behavior is a classic sign of increased anxiety. And that's a serious flag if you're thinking about using this in older humans.
Okay, and this is where it just gets truly complex. Because they didn't just study old mice.
No, they ran a parallel study on young mice starting at just 3 months old. Before any of that age-related decline has even had a chance to set in.
So what happens when you give this drug to a system that isn't falling apart yet?
Almost nothing, functionally. I mean, in the young mice, grip strength didn't improve at all. Rotarod performance improved just marginally.
Which really reinforces that idea that it's a mitigator of decline, not an enhancer of youth.
Absolutely. But the behavioral results...
They were the complete opposite, a total paradox.
Exactly the opposite. The young treated mice actually showed a slight increase in overall movement. And this is the kicker. They spent more time in the center of the open field arena.
Which indicates less anxiety.
Decreased anxiety or fear, yes. So you have a single drug causing opposite psychological effects based entirely on the age of the animal.
I find that stunning. What does that even imply? Is it that the aged brain chemistry is so different that it interprets the drug's signal as a stressor?
That's a great way to put it. It could be that the drug is interacting with receptors or circuits that are already, say, compromised by inflammation in the aged brain. The young, healthy brain gets this adaptive metabolic boost and feels less fear, while the old brain just gets stressed out. It really complicates the picture.
Okay, so let's move from these bigger functional results down to the molecular level. This wasn't just physical. You said it was multi-omic.
Right, and for you listening, when we say multi-omic, we mean they looked at the whole system, the transcriptome, which is all the gene activity.
What's being turned on and off.
Exactly.
Yeah.
Then the DNA methylome, which is how the DNA is packaged and regulated, and the metabolome, which is just a snapshot of all the small molecules in the blood.
So they look at everything, and what did they see?
Widespread counteraction. Exenatide was essentially rewinding the clock on age-related gene activity, and not just in one or two places. We're talking about the hypothalamus, the frontal cortex, fat tissue, the colon.
And even circulating white blood cells, right?
Even the WBCs. It was most obvious in those really metabolically demanding tissues. And this kind of systemic reversal is what makes you think this is a true anti-aging agent, not just a weight loss drug.
So then the question becomes, where is this effect coming from? Is it centrally controlled?
Yeah, that's what they wanted to know. The GLP-1 receptor is highly expressed in the hypothalamus, which is basically the body's master regulator.
The thermostat.
The thermostat, yeah. So they used a technique to basically turn down the receptor's activity just in the hypothalamus of the mice.
A knockdown. And what happened to the rest of the body?
The effect weakened, or in some cases was completely abolished. The age counteracting effect in the heart, in skeletal muscle, in the WBCs, it was mostly gone.
So the brain is coordinating this molecular cleanup across the whole body.
For the most part, yes. The hypothalamus is the hub. But, and this is a crucial but, there was an exception.
Which was?
The age counteracting effect remains strong in the hippocampus.
The memory center.
Right, which tells us that while a lot of the benefits are centrally mediated, the drug is also acting directly and independently in certain tissues. You get both CNS-dependent and CNS-independent pathways.
This whole molecular rewinding thing, it sounds a lot like other anti-aging strategies we've heard about. Did the sources compare it to anything?
They did. They benchmarked it against rapamycin.
The mTOR inhibitor, one of the heavy hitters in anti-aging research.
Exactly. And what's so compelling is they found a substantial similarity in the molecular impacts. Two very different drugs, different pathways, but achieving a similar molecular outcome in aged tissue.
Okay, that sets up a huge question for the future. But let's pivot now from the lab bench to the real world.
Right, from mice to humans. The sources looked at large-scale insurance data, Medicare and Medicaid, focusing on a really vulnerable group.
Older adults with both type 2 diabetes and cancer.
A very complex cohort. And to isolate the drug's effect, they had to use a very rigorous method.
Propensity score matching. Can you just quickly break that down for us?
Sure. It's a statistical method that lets you create virtual pairs of patients. Each person in a pair is almost identical in every measurable way. They have the same other illnesses, like heart disease. They're on the same other drugs, like statins.
Everything is the same except for one thing.
Except for the specific class of diabetes drug they were prescribed. It's the best way to try and isolate the impact of just the GLP-1RA.
So after all that careful matching, what did the survival curves show? Who lived longer?
The core finding was pretty clear. The GLP-1RA users had a lower cumulative incidence of mortality.
Compared to who? What were the other drug classes?
They were compared against two other common diabetes drugs. First, SGLT2 inhibitors.
Those are the ones that make the kidneys flush out extra sugar.
Right. And they were also compared to DPP-4 inhibitors, which work by boosting the body's own natural GLP-1 levels.
And compared to both of those standard of care options, the GLP-1RA users in this very sick older population had better survival outcomes.
Yes, a statistically significant association with improved survival. It's a powerful real-world finding that suggests the benefits go way beyond just blood sugar.
It really feels like the clinical data is backing up the molecular story from the mice.
It absolutely does. The idea that these drugs are doing something foundational, something whole body, It's supported by both lines of evidence.
So let's try to tie this all together. What does this all mean? We've seen these drugs step out from being just metabolic managers into a new role as potential whole-body anti-aging agents.
Right. In mice, they're targeting specific areas of decline while providing these broad molecular benefits. And then clinically, we see this hint of a real mortality benefit in a high-risk group.
So let's leave you with the 3 essential takeaways you should carry forward from all of this.
Okay, first, GLP-1RAs seem to have a highly selective mechanism. They're not a universal fountain of youth. They primarily fix what's already starting to fail, like muscle power and coordination.
Second, the benefit is demonstrably whole body. We saw that in the multi-omic data, the signature of aging being counteracted everywhere from the brain down to circulating blood cells, and it's largely coordinated by the hypothalamus.
And third, this isn't just a mouse story. In a large human cohort of older adults with both diabetes and cancer, using GLP-1RAs was associated with a lower risk of death compared to other common diabetes drugs. That gives this whole idea some serious real-world weight.
Okay, so for our final provocative thought.
Let's go back to that comparison with rapamycin. The sources noted that strong molecular overlap, but we also saw that GLP-1RAs had these really different behavioral effects depending on age rate. More anxiety in old mice, less anxiety in young ones.
A huge difference.
A profound difference. So the question for you to think about is this. How can researchers now systematically compare these two approaches, GLP-1 agonism versus mTOR inhibition, to figure out which one offers the safest, most holistic benefits across different stages of life? Because what works wonders in your youth might actually be detrimental in old age. That's the next frontier.
A fascinating and incredibly complex question. Thank you for diving deep with us. We'll see you next time.